You may be surprised to know that St John works in more than 30 countries around the world, providing not only community-based first aid, but also promoting health and well-being and delivering community-based healthcare and support services. In 2016, St John reached more than 3.1 million people across the globe. The beating heart of St John is our volunteer army of everyday heroes. Currently numbering more than 230,000 worldwide, our volunteers, half of whom are under the age of 25, fulfill our values of service to communities. First aid can be the difference between a life lost and a life saved. That's why in dozens of countries we teach people essential life-saving skills. We want to help make sure in your community and others just like it all around the world that there is someone who can respond in an emergency, whether it's a traffic accident, an injury at home or someone hurt in the workplace. St John is committed to making sure a trained first aider is never far away, and we have passed on the necessary skills to 2 million people across the globe. One example of this work is our First Aid School programme, run by St John Ambulance Australia, which has trained more than 1 million students. That's nearly 20% of the country's student population. But we know there is still plenty to do, and we will keep trying our very hardest to create lots more potential lifesavers. When someone is hurt or taken ill, communities need people who can step in to provide first aid until professional emergency services arrive. Community first responders are the volunteer community heroes who do just that, using their training to stay calm, assess a situation quickly, offer reassurance and give treatment straight away. And they're certainly making a valuable contribution. In the past year, our community first responders in England attended 10,000 emergency call-outs. Across the globe, St John Ambulance also provides much-needed ambulance services. From England and Australia to Malaysia and Hong Kong, we have highly trained, patient-focused people using state-of-the-art equipment and vehicles to give help to those who need it. In Kenya, the challenge here is that rainfall can sometimes make roads impassable to heavier vehicles. But by using lighter motorcycle ambulances, we can transport mothers to hospital in time to give birth safely. And in Scotland and New Zealand, we provide a free community service known as Patient Care Services, or Health Shuttles, which transports people to essential medical and health-related appointments and then brings them home again.
Nice to meet you.
Nice to see you too.
Yeah.
Storms, floods and earthquakes are common in many regions of the world, and when they strike, the results can be devastating for communities. In countries such as Fiji, Mauritius and across the Caribbean region, it's important for these communities to be prepared for natural disasters. We provide training to help people protect themselves during and after these often calamitous events. Better preparation and knowledge of what to do should the worst happen can really save lives. Nothing is more joyful than the birth of a child. For every parent, it should be a dream come true. However, childbirth can have risks for both mother and child, and St John is working to save lives in Kenya, Malawi, South Africa, Uganda, Zambia and Zimbabwe, countries where maternal and infant death rates are high. our volunteers reach out to communities to give advice on healthy pregnancy and on postnatal care for both mothers and newborns. Working with the local health services, St John helps to make it possible for pregnant women to get regular medical checkups and give families advice on how to be properly prepared with a birthing plan. For many people, particularly the poor, elderly, disabled and people living in rural areas, easily accessible medical care is unavailable. So around the world, St John runs community health outreach programs to tackle this problem. Just one example is St John South Africa's work to provide eye clinics and also home-based care for people who are ill and homebound. Rates of blindness in the Palestinian communities of East Jerusalem, Gaza and the West Bank are 10 times higher than in the West. St John of Jerusalem Eye Hospital Group, which has been the only charitable provider of expert eye care in these areas for more than a century, continues to work to save sight and change lives, irrespective of race or religion. St John is leading the campaign against preventable blindness in the region, treating around 128,000 patients each year, including more than 5,000 cases of major surgery. As well as having medical centres in Jerusalem, Hebron, Anabta and Gaza, there is also a mobile outreach team bringing eye care to isolated communities, ensuring as many people as possible in the region get the help they need. In the USA, St John has raised millions of dollars to support the work of St John of Jerusalem Eye Hospital, as well as organising substantial donations of medical supplies and equipment. Mountains are beautiful and awe-inspiring locations that draw people keen on walking and climbing, but they are also potentially hazardous places. St John Scotland has supported mountain rescue teams since 1997 by providing rescue bases and vehicles, as well as providing rescue boats. Elsewhere on the islands of Malta, the St John Rescue Corps provides fully trained volunteers to carry out all sorts of rescue operations and first aid. Supporting Malta's professional emergency services, the Rescue Corps has developed capabilities in firefighting, high-angle rescue, urban search and rescue, surface water rescue and diving rescue. Dental care is just as important as other kinds of medical attention. Dentists from Hong Kong's Department of Health provide free dental service to people who are disabled. It's part of a partnership with St John Ambulance to provide dental outreach programs, which include dental health education and counselling for many local charitable organisations. Kidney failure is often caused by diabetes and high blood pressure. It means the kidney is unable to do its job of filtering out harmful substances in the blood, which is potentially life-threatening. In Malaysia, St John Ambulance operates several centres equipped with dialysis machines, which do the work a kidney would otherwise do. They support people who cannot afford this treatment or who live in rural areas and find it difficult to get to the care they need. Currently, St John Ambulance Malaysia manages 16 dialysis centres with around 230 machines helping more than 450 patients. Pain-relieving palliative care for people diagnosed with terminal diseases is a desperate need in many communities. In response to this need, St John Hospice in Antigua launched a palliative home care service in 2007. Much appreciated by patients and their loved ones, the service remains the only one of its kind in the Eastern Caribbean region to provide palliative care for the terminally ill. If you're unable to get out or you're unwell, it can be hard to meet people, especially if family members don't live close by. The Caring Caller scheme in New Zealand is aimed at people who live alone or feel a bit lonely and involves volunteers regularly phoning those people to check that everything is okay. The St John volunteers who become callers are community-minded, understand that everyone needs human contact and want to make a difference to someone's life by being a friend at the end of the telephone line. They say dogs are man's best friend, and the therapy dog program run by St John Ambulance in Canada certainly brings joy and comfort to the sick, lonely and those in need of a friendly visit.
Ready? Dance, moonwalk, moonwalk, ah boy.
Therapy dogs routinely offer comfort and companionship at facilities caring for the sick and elderly. In hospitals, they can provide relief and distraction for patients awaiting cancer treatments. Through special programs, therapy dogs help young children learn to read, and in some communities, they work with vulnerable or troubled young people and children with special needs. University campus visits are very popular, helping students to relieve stress during exam periods. As St John was founded on Christian principles, our core values are motivated by Christian ideals. Our goals are to encourage all that makes for the spiritual and moral strengthening of mankind, encourage and promote the work of humanity and charity for the relief of people who are sick, distressed, suffering or in danger. We are pleased to say that with the growing support for St John, people right across the globe are becoming empowered to improve the health and well-being of others within their communities.